Okay, now we're back for more information. So, Dr. Club, I'm interested in about joint health because I think a lot of the viewing audience can relate to that, be it having adolescent children that participate in sports, and also when you're more seasoned in age, and you're trying to maintain a healthy lifestyle of activity, and we're running into these types of things. So share a little bit about joint health, preventative measures, what do we do in the midst of it, and with the adolescents?
Well, that's an excellent question, and similar concepts between both those age ranges that you mentioned, but we'll kind of address them a little bit differently.
Okay.
So, particularly with the adolescent, middle of school, high school type of athlete, I think it's really important. One thing we've seen is that kids oftentimes are playing sports year-round. That's kind of specializing earlier. I remember when I kind of came through, I'd play baseball and then football and basketball, and you kind of rotate in the different sports. And now some of these kids will play soccer and they'll play it 12 months out of the year.
Wow.
So we've seen an actually increase in some of the injuries because you just don't have that rest period in the off season.
Okay.
So one thing we talked earlier about listening to your body. You see some of those symptoms we talked about before. Someone that all of a sudden comes in and can't, it has the inability to bear weight or put weight on their leg. And that's a pretty severe sign. Things like that are these aches and pains. Sometimes they're just aches and pains. Sometimes they're signs that, maybe we better step back a little bit and give our body a little break.
Okay.
So that's one thing that we've seen, particularly in the adolescent age group. The other thing is making sure that you institute a good conditioning program. In stretching and things like that. Everybody thinks that it's important just for someone as we get older to stretch. And you don't think about the fact that even at 13, 14, it's extremely important. So stretching, warming up, making sure you're ready to participate in whatever activity that is very important. A good off-season and in-season conditioning program where you focus on the muscles. One thing we've found a lot is the core and strength. The abdominal muscles, the hip muscles, are really what drives the lower extremities in sports.
Wow.
And it's a great way to prevent injuries.
Okay.
So these are some things that are coming about. We know that with girls, particularly in that age group, they're more susceptible to things like ACL tears even than boys. And part of it is the way that they're built. Part of it's some weakness associated with the way they're built.
Okay.
So it's extremely important that we focus on making sure we're conditioning and getting ready for the season, and not just kind of jumping in full force. Some of the same concepts are really not out of the question for the other age group we talked about, the weekend warrior, not necessarily playing high school sports, but just trying to be active, maybe playing a softball league or basketball, or just going to the gym. It's also very important that we first of all, if you have any kind of medical conditions that you're cleared by a physician to participate in the activities that you're thinking about becoming involved with. But then also making sure you warm up, stretch, the same kind of principles that we talked about with the younger kids. And then the other thing is we talk about cross-training. So many people, let's say I'm a runner, I say, well, I'm a runner. That's what I do. Well, maybe just running is not the best thing because that puts a lot of impact and loading on the joints, and it always focuses on one particular type of muscle group, whereas maybe you lift some weights as part of that, mix it up, maybe one day run, one day use the elliptical machine, mix in a little swimming, lower impact exercise with that. It's excellent for overall health, and it takes some of the stress and strain off your joints as opposed to that constant pounding.
Wow, that's amazing. I never thought of that before because again, Max, he runs and I never see him stretching. He just gets out there and goes for the pavement. And I'm thinking there's something that's not right about that, and here lately it's more and more, I feel this, I feel that. So for everybody watching, we need to, you said twice, we need to stretch and get our bodies ready for what we're getting ready to engage in that activity, and then mix it up some so we don't overdo the muscle groups.
Definitely.
Okay, now, this is another question. When do we know that it's just older aging versus we didn't do some preparation in regards to our activity engagement?
In particular, if you have some kind of symptoms. Well, some of these things go back to what we talked about earlier, and if it's a symptom that seems more severe on a scale, and oftentimes we ask, well, how bad